Okay. Good day, our dear professors. Today, we are going to discuss about the case of a 28-year-old male patient went to the clinic complaining of low back pain, mostly during trunk extension. He also reported having stiffness of his trunk, particularly his lower back, upon further assessment. He was diagnosed with ankylosing spondylitis and was referred for rehabilitation.
So for question number one, discuss the mechanism of the disease. Ankylosing spondylitis is characterized by enthesopathy, which means an inflammatory attack where tendons and ligaments attached to bones or joint capsule called enthesitis. In the spine, the primary site for this in the spine is the primary site for this enthesis, where the long spinal ligament or anterior longitudinal ligament attaches to the front of the vertebrae. Inflammation of the enthesis is called enthesitis. The disease is a major subtype of an interrelated group of rheumatic disease called the spondyarthritides, which are linked by the major histocompatibility complex class 1 tissue antigen HLA-B27, which is a gene known as a human leukocyte that the patient seems to have. Persons who have a close relative who has ankylosing spondylitis, such as a parent or a sibling, the risk of developing ankylosing spondylitis is increased. This again could be due to the presence of HLB-B27 gene. So next slide please. For the advanced cases, a new small bone will grow between the vertebrae because of the ossification that is triggered by the body's defense mechanism that will produce extra calcium due to the inflammation that is continuously progressing. The vertebrae will fuse together and it will become stiff and less flexible that can result in increased risk for fracture and low back pain. This fusing makes the spine less flexible and can result in a hunched forward posture.
So here are the different structures affected by the patient's condition. Sacroiliac joint and joints of vertebral column, the spine, hips, and the muscle of the lower back. For the sacroiliac joint and the joint of the vertebral column, the earliest symptom happens in the result from inflammation of the joints between the pelvic bone, the ilia, and the base of the spine, the sacrum. These joints are called sacroiliac joints, and inflammation of these joints is known as sacroiliitis. Inflammation causes stiffness and pain in these joints and can progress to fusion of the bone. Fusion of the vertebral column spine leads to the bamboo spine that can be seen in the X-ray. For the spine, your vertebrae may become weak, making them more likely to fracture or break. Fused vertebrae can flatten the natural curves of your spine and force it into a inflexible hunch posture. Vertebral fractures may occur spontaneously or with minimal trauma. For the hips, stiffness of the spine can lead to lesser movement of the hips, which is also result of inflammation of joints. As hip flexion contracture develops, the patient adopt a forward flex posture that may exaggerate the appearance of the um, kyphosis. For the muscles of the lower back, especially the erector spinae, it is due to the inflammation of the vertebrae. There is added pressure in the spinal cord, leading to tightness in the muscles in the back. Then, this tightness can cause muscle to spasm. Sometimes, ankylosing spondylitis leads to a spinal deformity such as humpback or abnormal kyphosis or swayback or abnormal lordosis. One of the key complications in this case is a vertebral fracture.
So question number three. As a physical therapist, how will you manage this case? So, as a physical therapist, we're going to manage this by first examining. The PT will take the patient's history and will ask the patients to describe what symptoms he experienced. When did the symptoms occur, and if they get worse with the inactivity and better with the activity. Ask the patient's level of pain, then perform the following examination test. First test is the Schubert's test. Limited motion in the lumbar spine is symptomatic of ankylosing spondylitis. The Schubert test measures the degree of lumbar forward flexion as the patient bends over as those touching their toes. Progressive loss of spinal motion is correlated with X-ray ratings. Second is the Gainsleys test. Sacroiliac pain is often found in early stage of ankylosing spondylitis. Gainsleys maneuver, another name for Gainsleys test, stresses the sacroiliac joints. Increased pain during this maneuver can be an indicative of joint disease. Then you have the chin brow measurement. This is a method used to measure the spine's curve in the neck. Patients with ankylosing spondylitis often have necks that angle forward sharply as the spine stiffens. If the doctor is going to use the chin brow measurement to monitor your angle, the first time he or she takes the measurement will be called your baseline. After that, the doctor will compare each successive chin brow measurements to the baseline to see if the angle gets worse. So next is the chest expansion. When ankylosing spondylitis affects the mid-back region or the thoracic spine, normal chest expansion may be compromised. The amount of chest expansion is measured from this deep expiration to full inspiration. Measurements significantly less than 1 inch with a normal chest expansion could indicate ankylosing spondylitis. And for the last examination, we have the range of motion. To test how well and far your joints allow you to move, the doctor measures the degree to which you can perform movements of flexion, extension, lateral bending, and spinal rotation. Asymmetry may also be noted. So next, we have the evaluation. So here are some pictures of the test. So for the evaluation, interpreting the findings will help in additional information in determining the following diagnosis, prognosis, and plan on care for ankylosing spondylitis. So for the diagnosis of ankylosing spondylitis is commonly made through a defined process of combination of thorough subjective and physical examination, laboratory data, and imaging studies. For the prognosis, the outlook for patients with ankylosing spondylitis is very much dependent upon the location and severity of its manifestation, which in the case is the lower back area. Anticipate the level of improvement and the amount of time needed to reach the level with the planned care to be given. So for the plan of care, first, we have the posture training. This is to improve posture and avoid slouching position and strengthening exercises to keep joints healthy and strengthen back muscles and to support the posture. Third, we have the range of motion exercises. It is to help keep spine and other joints from getting stiff. Next, we have the flexibility exercises, which promotes flexibility of spine as it gently stretches and extends your spine, keeping joints flexible and warding off stiffness. And next is water-based programs such as swimming. Water is an anti-gravity environment that is easy on your joints, and the pool prevents gentle resistance, which helps you comfortably build your cardiovascular health. And last is pain management techniques. Use of heat or ice pack to reduce and manage inflammation of joints. The next, we are going to proceed to the intervention. You're just going to perform the plan of care, and we're looking for the outcome is to reduce pain, alleviate morning stiffness, increase spinal mobility and functional capacity, and also to correct postural deformities. So that will be all. Thank you for listening and have a good day. Boom. Okay na yun.
Nice one.
Nice one.
Ilang minutes?